I would like to invite Dr. Anuradha Pichumani. She is the Executive Director, Sri Ranga Hospital, Chengalpet, Tamil Nadu, and she is also the Chairperson of Quality Professionals Wing of CAHO. Over to you, Madam.
Yes, sir. At the outset, CAHO is very happy to welcome Professor Pichumani, President, Joint Commission of Taiwan, to this continuing quality education series conducted by CAHO in collaboration with ASQA. I would now like to introduce the next speaker, Professor Dr. Ching-Tai Huang. He has obtained his MD from Taipei Medical University in Taiwan and a PhD from Johns Hopkins University, USA. He has extensive clinical research experience in infectious diseases and in immunology with a specific focus on influenza virus and cytokine storm, very topical themes in today's context. Professor Ching-Tai has published his work widely in peer-reviewed journals. He is currently the Professor, Division of Infectious Disease, Department of Medicine at the Lin Kau Chang Gung Memorial Hospital, Taiwan. I now welcome Professor Ching-Tai Huang to deliver his talk on the best practices in sterilization from Taiwan. Over to you, sir.
I will just take a little bit of time to share some of our experience of the practice in sterilization. I think we are very familiar with this topic, so I will just give some principles in general, and we may discuss any details as we want after this very brief introductory statements. So we use medical items every day from time to time, and we may divide the medical items into 3 categories. One is critical items, and the other one, these items where we use them to penetrate into sterile cavities or the vessels, and these are the critical items, and we have to sterilize them before we use them. And the semi-critical items such as the endoscope, and it's a close contact with the mucosa, and the mucosa is fragile, but it's not penetrating. So we don't need a strict sterilization, but we need a high-level disinfection. And all the other items are non-critical items. They will just touch the skin of the patients or other tough surface. So low-level disinfection or even cleansing is enough. So we will focus on the sterilization process of the critical items. So by definition, sterilization means you have to remove, kill, or deactivate all forms of life. In particular, we refer to microorganisms such as fungi, bacteria, spores, any unicellular eukaryotic organisms such as Plasmodium, and other biological agents such as prions. So we have different methods of sterilization. We all understand we have physical method. We can use steam, dry heat, radiation, hydrogen peroxide plasma. We may also use chemical ways of sterilization, such as ethylene oxide gas or activated glutaraldehyde, or we may use peracetic acid. But for all the process of assessment, we have to have some ways of monitoring. We may use biological monitoring. We call the indicator biological indicators. We put the biological indicators in such a device we call the process challenge device, PCD. We may also use chemical monitors. These monitors are chemical indicators, CI. And for the machines, equipment we use to sterilize, we use mechanical control to ensure the well performance of the machines and the equipments. And the assessment, we have to pay attention to the expiration date. After we finish the sterilization, we have to label an appropriate expiration date on the surface of the medical items. And every time we have to pay attention to the the label whether this sterilization process has passed the expiration date. So now we talk about the daily procedures we have to follow or take a very special notice. First one is the traffic flow. Every hospital has its central supply center. For that center, for proper operation, we need appropriate allocation of the space. And the traffic flow has to follow one direction. People or items has to move through the traffic flow of one direction, not to contaminate the thing along the line. And we also have to make a device for the airflow. The airflow has to flow from clean area to the contaminated. And hand hygiene facility has to be well equipped all over the place in the supply center. And first procedure is to clean or cleansing of the medical device. All the personnel has to wear appropriate personal protective equipment, and all the operation of cleansing has to be performed below the fluid surface, not to disturb, generate any contaminants into the air. And after the cleansing, we need to monitor whether the cleansing has been completed. There are many quick methods of doing this, and we do this clean surface ATP in Taiwan very often. And the next procedure is to pack. The packing space have to be kept with appropriate temperature and humidity. We recommend the temperature to be between 21 to 24 degrees Celsius, and the humidity has to be between 30 to 60%. And before packing, the medical items has to be dried, and we have to check whether all the items has been dried before we pack them. And of course, we have to inspect whether medical items has been damaged and discard the damaged items. Some sharp materials we have to wrap up the sharp side, not to hurt the packing material or hurt the personnel. And there are different packing materials, and we have to choose appropriate material to be sterilized. And we have to label the packs, but it's better to use tapes and write the label on the tapes, not to damage the surface of the packing material. And for CI, for chemical indicator, we have a chemical indicator tape. We put chemical indicator tape on every individual pack. So after pack, we put in the sterilization equipment, and we have to have some quality control measures. Of course, we put the metals, we put the materials, we put the items into the containers, have to be layered. But usually we put the metals at the bottom and the light things on the top. Especially for the metals, sometimes after the high temperature evaporation, there is vapors, and they may drip down onto the surface of the layers at the bottom. So it's better to put the metals at the bottom layer and other items on the top. And of course, no overload for the container, not to load more than 80% of the space. So during the sterilization process, we have to check time, whether how much time we have spent with the process, and whether the temperature has always been kept at the desired range. And for the pressure as well. So after the sterilization, we have to cool down the items before we go to the next step of storage. We have a separate space for the process of storage. We keep this this space with temperature below 24 degrees Celsius and the humidity below 70%. And we store the packed items. We have to pay attention to the space between the materials and our sealings. The material and the space between the material and the floor, and the space between the material and the wall. At least 5 to 10 inch is necessary to keep the ventilation and everything well fit for the medical items in storage. And for management, all the medical items has to be first in and first out. And we may use the items sterilized with a remote date and not to pass the expiration. And of course, before we supply these materials for the clinical use, we have to make another inspection. So it's very general principles we follow in Taiwan, and we may share some details with all the audience. Thank you for your attention. Thank you.
Thank you, sir, for that very informative session. It's always helpful to know and learn best practices across the world. And I'm sure it would have helped all our participants here. One question: what is the packing material which you use in your CSSDs?
Oh, so we have different kinds of materials we use, and some papers, some linens, and we have the specific indications for different kind of materials.
Okay. Okay. Thank you, and thank you so much.